Hi, welcome to Because Looking Good Feels Good with me, Dr. Janet Allenby. And today I have a great guest and something that is very dear to my heart, which is about non-surgical body contouring. So we have a special guest from Allergan today, and he is Brad Hauser, and he's going to be talking about the technology behind the Cool Sculpting and Cool Tone. It is if anybody knows, I am huge in this area. I love it. I was doing, actually, I'm going to get Brad on right now. Let me get him on. And he should be joining us. So he's waiting to get on here. Anyway, Brad, hi, how are
How's
you?
it going, Dr. Allenby?
Thank you for joining us. Now,
Absolutely.
you're coming from Northern California, right?
I am.
Oh, wow. Well, it's like early for you.
It is
Sort of.
bright and early, but it's a wonderful sunny day, so good weather.
I know, you know what? We do live in great places. You up in Northern California, us here in Florida.
Absolutely.
Thanks for having us. I was just introducing you without you to my guest. Brad Hauser is Vice President of the Research and Development, which like where all the thinking goes on for body contouring for Allergan. Also general manager for body contouring for Allergan too. And for those who don't know what Allergan is, it is like one of the biggest aesthetic companies out there. It's the group that brought us Botox, Juvederm. So they hired Cool Sculpting a couple of years ago, but just a little background on Brad is he's been in sculpting for years. That's how we met a long time ago is when I went to one of the facilities that does the training, and I met Brad and his brother Brent, and I was just overwhelming the thought processes that were going on and the innovation that was going on, and I think that's what was really like exciting. And since we both know that body contouring and aesthetics is just like it's the fastest growing area right now. So you're in a great field, and you already know that I'm sure of. So thank you so much for coming on board here today.
Yeah, absolutely. And first off, thanks for inviting me to join you and your patients. And I hope everyone is staying healthy and safe during this time. So just best wishes to you and all of your practice staff and patients.
Let me ask you on that note. No, are you guys really? How's the quarantine going for you? I'm going to say it that way.
Yeah, we got started pretty early. So I think March 14th or so, they
Wow.
pretty much locked down the Bay Area. So we've been cooped up working at home for some time, but luckily everyone in our company that I know of is healthy and safe. But it has been a new working environment, no doubt.
Oh, it's been crazy. I think we were later to the game, and I really do wish we could have gotten in there a little sooner. I personally locked down at about the 18th of March, and I really do think we just all need to lock down so we can get back in quicker. And I don't think people
Absolutely.
understand if you lock down now, you get quicker back to what you normally do, and the people that are kind of straggling and this isn't going to affect me, it's going to affect us longer because of these people. So everybody out there who's listening, you better please go lock down. I want to get back to the office. I'm tired of being at my house, and I'm sure you are too.
Absolutely. Yeah.
It's we all love our houses and our family and the people that we're around at a normal time, and it's probably unique to all of us. But it's definitely there. It's fun to go to the office and escape the house sometimes.
Absolutely. The personal contact is so critical, social. We are
Oh,
social beings, right? So
yeah.
we want that social interaction. And I think, like you said, we're hoping that we can get back to the office. It won't be the same way as when we left the office, but
Right.
in early May, I think hopefully we'll get some people back in the office. That's good.
I know. I'm hoping we're going to be some point in early May. I don't know. It's just we kind of started slow on the lockdown, so it might hamper things a little bit. We just keep having more cases, more deaths, unfortunately, down here, which is, that's ultimately why we're all at home. We don't want people dying over this thing.
Yep, absolutely.
So now you have not only a background in the technology of cool sculpting, and soon we're going to talk a little bit more about cool tone, because that is like, I love this whole area anyway, but you also have a background in medical aesthetics as far as lasers and laser brands that most of my followers would know.
Yeah, absolutely. I've been in the industry for a long time now, about 17 years. Got started in a little bit of a non-traditional sense. My background, I went to Stanford University undergrad and studied sports medicine. So when we get into cool tone, I'm extremely passionate about it just because of my background in sports medicine, as well as I was an athlete. And post-collegiately, I got to an opportunity to actually run professionally for Nike. So I did that for a few years. And then when I hung up my shoes, I was involved with the founder of an aesthetics company, which was Reliant Technologies, that developed the fractional laser.
Mm-hmm.
And I started basically as an administrative assistant. I did facilities, put up walls, did all these sorts of things while I was trying to go back to med school, become an orthopedic surgeon. But I got sucked up in the industry, just loved it, and was able to move up through both marketing and R&D functions and moved to several companies since then, but ended up at Cool Sculpting about 7.5 years ago.
Mm-hmm. Well, I am actually learning a lot about you that I did not know. So this is great for me. On top of, I love what you do. Your professional level is so, just such at a high level. That's one of the big things that I was always impressed with about Cool Sculpting when it was Zeltique and now with Allergan. It's just, everything is done with such high quality, and there are a lot of fly-by-night devices out there, and you guys really know how to put a package together. Honestly, like, look at Cool Sculpting when it first came out. It was a whole different machine, and you guys have developed it, and you continually keep coming out with new applicators, new hand pieces, new ways of helping people. And the cool tone is a whole other realm, which I agree with you. It's like definitely a passion of mine too. It's impressive.
Yeah, absolutely. I think the aesthetic side, as you said, has a part of it that is not as credible or doesn't have the amount of clinical rigor. I think Zeltique, from very early on, the technology came out of Harvard or Massachusetts General Hospital, and the company worked closely with key opinion leaders like yourself and other institutions to really bring the science and understand what was happening. And Allergan has always been about that. The products are always about what is in the best interest of the patient, and how do you really prove that the science and clinical rigor is behind it.
And that's huge. And definitely in our world, for those who are following, in the beginning, prior to what's actually out now more, we really, and this is like over a 20-year span, we would get a device and you kind of cross your fingers that it worked, and sometimes it helped a little. So, it's just the level of effectiveness, or, getting the results that are actually touted, is such a change. And I think, and I'm so happy about it, because, we all know these machines are very expensive to us as physicians, and they do end up costing patients some money to have the treatments because of that cost. But it really is that you're actually getting what you're paying for, which is a huge difference. And that's, I think, the beauty of it. Yeah,
I think Allergan, no doubt, and the Cool Sculpting product is in it for the long term, right? That's where this isn't short-term gains. So we've invested a lot of effort and research dollars in clinical studies. There's, I think, over 100 peer-reviewed publications now. There's over 6,000 patients that have been treated in clinical studies over the last 10 years. And we continue to invest. Innovation is also another passion of mine and our company. How do we continually optimize and make our products meet the needs of the patients is what we try to do.
Right. And I think that that is still kind of unique in this field. And that's why I have this series, is to really let the followers know, what's real, what's not real, what to expect out of something. And again, being realistic with what the expectations might be. And we have to touch on cool tone before we even ask any other questions, because for, this, like you were saying, it is one of my huge passions. And that's actually why I opened the Body Squad. And it's because cool sculpting was amazing. I did used to do minimally invasive, liposuction, and it was horrible. I really did not enjoy it. And it was just like, I wanted results, but it was just too invasive to me, even being minimally invasive. So then when the magnetic muscle stimulation came out in the market about 2 years ago, and I was like, this is incredible. You guys latched on and took it to the next level. I mean, for disclosure, everybody, I have cool tone. I had another product before that was excellent to start with, but this is, to me, the next generation of where this technology is going. We have to always be careful with what we say out there and not to offend too many people, but I really am, I've already had it's about 9 months of experience with cool tone, which you guys, and because I was in some of the earlier studies with the beta unit. Now you've been on the market now since
we've been treating patients for just about 2 years now, a year and a half, 2 years, and then the first commercial systems went out in late 2019.
Right. Okay. Yeah. And again, it's wow. It's a wow. It's everything that we needed to upgrade in the machine. You guys listened and you brought it to a device for us, and definitely we appreciate that. And I think, there's just been a little bit of, because of the coronavirus, all these things, I think it's a little bit harder for people because they may not have heard about the new technology that is, available now. And I think that this is like a great venue for people to at least hear, what's the difference in some of the other machines out there. Because, they don't know. They're looking things up and they get, I get the Ab Buster on Amazon for $39. Why shouldn't I just buy that one? So that would be one of the things, is maybe because you're much more, the technology. Can you, in a layman's term, give a little bit of information for those who don't know, and I don't know who wouldn't know about cool sculpting. Cool sculpting is kind of like, like share or print, one word, who it is. It's like so well known, but so people who don't really, they think, it probably doesn't work. What can you tell them about cool sculpting? And then let's talk cool tone too.
Yeah, perfect. So, I mean, I think it's, like you said, cool sculpting, the brand is well known, but how the technology works is actually very unique. So I think it's very important. Patients obviously have more resources now. They're more savvy. They're online. But really understanding, when you're looking for a treatment or an outcome, how that technology is interacting with the body or that tissue layer that you're trying to treat. So cool sculpting, the way it works is, and the way it was found actually, was the scientists at Harvard, they were looking in the literature and they saw some reports of a baby popsicle paniculitis. So babies would suck on popsicles, and on the inside of their cheek, they would lose the fat because of the temperatures of the fat cells. So why is the fat cell more susceptible to cold? Think about olive oil being put in your refrigerator. It becomes a solid at a warmer temperature than water. So that gives us a selective differential to be able to freeze or cause lipid crystals in the fat cells. And that actually is what injures the fat cells and then signals itself to die over the next few days. And the body comes in with a wound healing response and clears out the dead fat cells. And that's how it's localized fat reduction that cool sculpting does. And when you look at the technology we use for muscle toning, firming, and strengthening with cool tone, it's basically intervening with the nervous system that triggers the muscle contractions. So the way a muscle contraction is created, or that we walk or move, is that our brain or our central nervous system sends an electric impulse into the motor nerve or the motor neuron, and that triggers what's called an action potential that causes a cascade of events that eventually causes the two actin and myosin fibrils to connect, and it contracts or shortens the muscle. When we use these technologies from an external standpoint, the mechanism is identical. We're just sending in an electric impulse into the motor neuron with a device rather than the brain. So a lot of research had been done for paraplegics and other people that had injuries, spinal cord injuries, and these devices could be used to actually cause contractions past the point where the brain could send the signal, because the injury was in the motor nerve there. So that's kind of how it works. And then there's different types. You have direct electric contact. So you mentioned some things that you can buy online. There's a lot of marketing out there. And what that's doing is that's sending in a direct electric impulse through the skin and the fat to trying to reach down to the muscle. What we do with the Cool Tone is magnetic muscle stimulation. We use an electromagnetic field. So the advantage of that is that it only creates the electric signal in tissues that are conductive, and the skin and the fat layers are not as conductive. So we can go deeper into the muscle to create the contraction, because the muscle is where the electromagnetic field is basically absorbed and turned into current, which triggers the contraction. So once again, it's a selective type of treatment for the muscle specifically. When you go to the ones you can buy online and you're going through the skin and the fat, that can cause some discomfort because they're sensory nerves. That electric impulse then interacts with the sensory nerves.
Have you ever had Tenzu to put on you? It's not some, it's a lot. Okay, if you don't mind getting electrocuted, it's a great technique.
I have. It's they can cause contractions, but you definitely feel it in the skin, and you can get heating in the skin too.
Yeah, like burn holes. So, yes.
Yeah.
Well, I think you're being quite kind to that particular device, because that is one of the big things that people ask about. They're like, I've used these TENS units. I used them at the chiropractor's office. They were using it to like massage me. And that's like, this is a whole different level of science. And I just saw a scroll through. I don't know if you saw it. They're like, he must be a scientist from Stanford. He is smart sounding. So so people are listening. Now I kind of, and I could be wrong, so please correct me if I am. I mean, first of all, both of these machines, Cool Sculpting and Cool Tone, I do not see that I could reach the level of what I can change in my own body or a patient's body. I can't do that myself. Like, I could go to the gym for 7 days a week, 20 hours a week, and I'm not going to get what I get from either of these two devices. And I love that I am a little on the lazy side sometimes. So this is a great way to kind of cheat the system. Is that a realistic thought, or is that?
No, absolutely. So this is where my background as an athlete, and I get so passionate about this. I'm no longer an athlete. I go out and I jog and do things like that. But
you're normal, like us.
The difference between the elite athletes and us normal people is that when we train, the brain learns how to utilize more of our muscles. And the only other scenario this happens in is where you see those superhuman feats. The mother lifts a car off of a baby, and that's pure adrenaline driving the body to trigger all of our muscle fibers. So when we become in our normal activities somewhat complacent, our brain learns that we don't need to use 100% of the muscle fibers.
That's me.
Yeah, it's probably only using, for most of us, somewhere between 30 and 45% of the muscle fibers in a muscle belly. What we can do with this technology is, by using different protocols and signals to that muscle, we can utilize all those muscle groups. So people will say, well, why don't I just go to the gym? And it's because in the gym, you're not utilizing all of your muscle fibers when you lift a 25-pound barbell. Whereas this technology intervenes in that motor neuron and will actually activate up to 80–90% of those muscle fibers in the 30-minute treatment. So in a way, you can do much more with this technology than most of us can do in the gym. And then that begs the question is, if you are a bodybuilder, an elite athlete, will this bring further advantage? In certain scenarios, no. I mean, but every individual and every sport creates weakness. And where I love this technology is strengthening the areas, even on athletes that are weak. I was a runner, so I ran in a straight line. So my adductors and abductors going lateral were not good. So I still use the Cool Tone today to strengthen my core and my hips where I need to be able to strengthen going sideways rather than just in a straight line.
No, you know, you're 100% right. I think one of the hooks for me when I first tried these devices was, wow, in one treatment I was already stronger, and that was, you know, incredible. Like for me at my age, I think what I would see, and typically on my patients also, is that it's a little bit slower visually, and you know, in aesthetics, being you know, getting rid of fat is one thing, but actually looking healthy and having tone puts you into a more youthful state or look. And I think that's such a huge piece. But also at my age, where I know that my body isn't as strong as it used to be, and you know, I really was shocked on how much strength I got from it right away, which the core strength was huge. And you know, like you said, maybe like, you know, helping people with, I definitely see this in rehab medicine, you know, helping people kind of rehabilitate their compromised systems that, you know, you probably have some injuries from your running days that now cause some hip problems and all sorts of things, I would imagine.
Oh, absolutely. And I think it's always important to remember that these aesthetic procedures, the way we look at Cool Sculpting and Cool Tone is more of a healthy lifestyle wellness type of brand. You need to be active. You're going to be happier. You're going to be healthier. You're going to look better, right? The goal eventually is to look better and feel better.
Exactly.
And I think when we do Cool Sculpting, it isn't weight loss. That's not what the objective is. The objective is to get people where we are active and we still have parts as we age that we struggle for, love handles below the lower abdomen for women that you just can't get rid of no matter how much you do. And we don't have time to do 10 hours a day, 5 days a week.
No,
so it's really for that individual that wants to be healthy, and it's a good kickstart in both technologies to help you get to the way you want to look and feel. And Cool Tone is a lot about the strength aspect and making sure the core is so important for balance and just strength in general, that I think it's a great way to get people living and feeling better.
No, and you know, that is the goal in our office, both offices, is living healthy. You know, it's the name of this whole program, because looking good feels good, and it really it just resonates with all the people that come through the office. You know, I will say the core strength, huge. I still use my Cool Tone on a regular basis because I don't want to lose that, because once you have it, it's just, wow, I don't want to lose it. I will tell you though, I know we've discussed it in the past, I really, for women, you know, the legs are always an issue for women. Like women are from the below the belly button to the knees are usually the women's area of most dislike on their body. And a lot of it is the thigh shape. Just you either never had it or it kind of falls apart, just like every other shape seems to fall apart. But the thighs, filling in the muscle strength or filling in the muscle tone of the thigh really changes how the thighs look. And you know, that's a huge piece for women, especially in, you know, our climate with the short shorts, bathing suits, more exposure, maybe where you're a little more covered, it's not as strong of an issue, but I think it's just, it's a game changer. And I really think that, to me, that's just one of the best things I've seen. You can do it on the front of the thighs, the back of the thighs. You can do it on the tushy to get a little more lift, and I think that for a lot of women, that's their struggle site. And it's been a home run for me personally. So,
yep. I think you said something early on that resonated with me, is that just setting expectations. And I think that's so critical with any technology. And that's obviously through the physicians that we do that, but the companies are responsible for making sure we give you the science that you can do that. And I think what you mentioned there, we talked about strength. Yes, after the patient goes through a series of cool tones, they're going to first feel the strength improvement. And in order to visibly see the improvement, there's a number of factors that come into play. Obviously, the amount of fat layer above the muscle, because remember, the muscle is underneath the subcutaneous fat, does play a role in whether or not you can visibly see the definition that's created. A lot of patients talk about how they can feel their abdomen now underneath their fat layer larger, but that doesn't necessarily mean you can see it. So it is about also doing fat reduction first and making sure that you reduce the fat layer to be able to see that definition.
Right.
And the definition really starts to show at about 4 weeks, because the muscle also has to rebuild, right? So we're injuring the muscle, and that takes time to rebuild. And then the other question we get a lot, well, does that mean I'm done? And with muscle, unfortunately, just as I'm no longer an elite athlete, I used to run hundreds of miles a week. I can't do that anymore. So muscles do atrophy, and there is maintenance required. And it really depends on how much activity you do. If you're using the strength that you built, you're going to maintain it much longer than if you're just sitting on the couch. So all those things are important to remember when you're thinking about a treatment like this.
Right. So for those who are listening, and I think there was a question somebody had written in, you do need to maintain with this. Typically in my office, we do anywhere from 4 to 6 treatments initially, depending how deconditioned the body really is. And again, you see the results probably in about 4 to 6 weeks. But then I personally think most people would be best off, especially if they're not able to get to the gym as much, because the gym does require a lot of time. And I think that most people can treat again, just make a single treatment, which is a half an hour treatment, and do that probably anywhere from 6 weeks to 8 weeks after. And if you kind of do it on that cycle, you will see the maintenance of this a lot better, for sure.
Yeah. I mean, I think we're seeing patients even out to 3 months if they're active. And it doesn't mean you have to be in the weight room. If you're jogging, walking, cycling, swimming, tennis, golf. I've got a number of golfers that talk about how their improvement in their game just because of the core strength that's built with the treatment.
Well, we've got a lot of golfers down here, so I think that they're going to love hearing that one. No, I think it's been such a fantastic non-surgical, no downtime. It's definitely with Cool Tone, it's a half an hour treatment. The Cool Sculpting, the benefit of that is there is an end point. You can end up treating to completion, and you can permanently eliminate, as I guess the word is permanent in my world, maybe not in your world.
Long lasting,
exactly. It definitely, we see long-term results with Cool Sculpting that the problem with Cool Sculpting, and I'm not gonna say it's a problem, I think it's once you do one area, you're addicted, you want to do another area, then you want to do another area. It's kind of like eating potato chips, you're like, this really worked. So I think,
that goes back to the mechanism. The reason why it's long lasting or the fat cell itself, are fat cells, they don't regenerate. So once we've actually killed the fat cell, those fat cells remain dead forever. So that's an advantage over what we talked about with Cool Tone, where muscle doesn't, once you build it, it doesn't maintain forever. It's just biologic difference in those two tissues.
Exactly. And, but it's just part of, if you want a certain lifestyle or look, this is just helps you get there. And you can't do this on your own. Honestly, I mean, you cannot reach the same level of contraction. And, I mean, I see that on myself personally, and we all followers know I am all about myself, and I'm very like, okay, if it works, if it works for me, I love sharing it, but I definitely am not going to use something that doesn't continually help people or help me at the end of the day, as nobody should. One of the questions I think was, if somebody had a hernia repair, and personally, as long as there's no metal in the field that we're treating, and it's repaired, and we monitor people when we put them on the device, and if they have discomfort, we won't use it. But if they're not having discomfort, it's not pulling funny, and this is about cool tone and contraction. Usually hernias like in the groin area will sometimes be a problem for people, and that's, they get them repaired first, and if they're cleared with their doctor, they can do this treatment just like they can go to the gym if they
just like they can go to the gym.
Exactly. Yep. So, yeah, I have had a lot of people who have had a lot of medical problems, and they're seeking this out just because they want to get stronger, they want to get toned. So I do think that the strength piece of this is just such a huge portion, and you feel good when you have strength.
Yeah, absolutely. And I saw some other questions. You mentioned metal. The reason why metal cannot be in the treatment area, as I talked early on, how the muscle is more conductive than the skin and the fat. So anything that's conductive, the electromagnetic field will actually generate current, or in metal, it generates heat. So obviously with a metal implant in the treatment area, there's a question about a pacemaker. Any type of pacemaker is contraindicated.
Yeah, that's a big no.
You can't, unfortunately, use strong electromagnetic fields with those types of any type of implant like that.
Yeah, I mean, overall, the rule of thumb that we go by in the office is that if you can have an MRI and we're treating directly over a type of metal, because there are some metals that are more conductive than others. And so if somebody had a knee replacement titanium, I'm fine treating them. And I'm not talking for Brad, I'm talking for my office, but definitely that if you can have an MRI, this is the same sort of wavelength or electromagnetic wavelength, and I'm fine with it as long as people aren't feeling funny. If they ever have an issue, obviously that we're going to stop them from that one. So I think we actually got through some of the questions I really wanted to. You offered so much stuff up that you really helped a lot with this. And is there anything that you could tell us that you guys might be maybe a field and direction that may be happening in the future, since you guys are quite innovative?
Sure, I can give you some insights, just because you're one of our top customers. No, with the R&D organization that I lead up at the Cool Sculpting sites, we really focus our R&D resources in a few different areas. First, we always want to make sure, we talked about Cool Sculpting was introduced, the technology, about 10 years ago. And we've added, that was with one body area. We just had flanks and we had one applicator. So we really spend a lot of time investing in the platforms to make sure that there's a long-term solution for the patients. And once we get out there, we learn more what patients want and what they need. And we always come back and try to enhance or optimize that. So we're always looking at our platforms on Cool Sculpting and on Cool Tone. How do we bring new body areas, new indications? Cool Tone could be very interesting once we look at the functional benefits. So strength right now is something that is on label, we can talk about and train on, but we're looking at other benefits, functional benefits, including balance, posture, and those sorts of things that the muscle strength brings. So we're doing studies in those areas. So a lot of our resources are spent, how do we bring new applicators, new, stronger systems, software, those sorts of things out to our existing platforms. And then, so you'll see a lot more of that over the next few years, both on Cool Sculpting and on Cool Tone. And then we also look at, from a body contouring, a holistic approach. Cool Tone was our first step outside of fat reduction. So I mentioned Cool Sculpting is really, the technology is suited to reduce the fat layer, and Cool Tone strengthens the muscle underneath, which provides some support and stability. We're also looking at the other component of body contouring or body sculpting, and that is the skin layer. So we'll always be looking at solutions that can bring an enhanced outcome for the patients.
I like that coded discussion there. You guys, you can, I'm not going to put Brad on the spot. We appreciate that he's joined us. And actually, you know, again, I am going to just say, I love that you guys are so good about, you know, when machines need updating, upgrading, it's not like you're killing us physicians to have to purchase more to get us there. You basically just come and do it, and that's just part of the service of having a full service company such as yourself. And there are a lot of companies that aren't like that. So you buy it once and you have it in your office for 10 years and it hasn't gotten upgraded in 10 years. You're looking at old technology on people. So it really is a huge advantage having such a powerhouse behind these products, because it really does bring a lot more credibility, but also the ability to be innovative like you are doing.
Yeah, and that's a huge advantage of being Allergan. This is something a small company that where Cool Sculpting started really can't do because the investment is so high. Where Allergan, we use the breadth of the whole portfolio. I mean, Botox and the Juvederm families, those things. When we look at the practice and the patients, it enables us to be able to provide bigger benefits and invest more back into the R&D, which is such a critical component to bringing out these innovations year after year. And we always try to do it, once again, for the patient's best interest, but also for our customers. Our practices are so important to us.
Well, we appreciate it. And before we let you go, because I know I've taken up a lot of your time today, okay, it's crazy out there. And how are you keeping centered and have some good vibes going on with you?
Yeah, it's difficult, right? I mean, we're all on video conferences all day, but I'm somewhat very, very fortunate in the area I live. Just like you, we've got great weather. Although I'm in the Bay Area, which is pretty crowded, I'm in a town that's not as crowded, so a lot of open space. But I keep a regular schedule. I've got two young boys, 11 and 13.
Aww.
So we do a lot of hikes, soccer, just a lot of outdoor activities, and keeping sane. So it really is about keeping.
Funny.
Go ahead.
I think it's amazing how many families have kind of gotten themselves back together again and are like a family unit again because of this. So
absolutely.
Yeah. So yeah, it's nice to hear that. I mean, like, you know, getting to spend time with your kids, and a lot of times you couldn't have done that before.
Absolutely. And then from a work standpoint, we're all working from home, so video has become such a key component to that, but we're trying to do things that keep our engineers engaged. We're doing large Zoom meetings where we do some, obviously we have to get the work done, but we're trying to also keep that social interaction. Mm-hmm. So happy hours and things like that via video. It's a new life, but we're getting through it. And I think as a whole society, we will get through this. It's just a matter of doing it a little bit differently.
No, and you know what, it definitely, the winner at the end of this is being innovation, and whether it's innovation in the medical field or anywhere, that's what's going to get us through all this.
Yep.
So thank you so much for joining us. I'm going to tell the people about some specials, but you are a gem. Thank you so much for your joining us and all your knowledge.
Absolutely. Thank you so much for having me, and everyone stay safe.
All right. Thanks, Brad.
Bye.
Bye. He was so delightful. You know, how much information do you get from Brad? He is just a fantastic person. Just so you guys know, we do have Cool Tone, a free Cool Tone when you buy a $500 gift card, just so you know. So that's the value of $750. And you guys, the price is less expensive when you're doing packages anyway, when you're back in the office. So it is definitely doable. We work with people because we know Cool Tone is something that you are going to keep doing. So just, you got to call us. We're doing virtual consults. We're doing virtual consults in the Body Squad. We're doing virtual consults in Allenby Dermatology. So please engage with us. We want to help you be the best that you are. This is all about, because looking good feels good. We know that. We want you to be there too with us. So I certainly appreciate you guys joining us and spending your time with us, and have a great day. We have a great guest on Friday. So a new lip filler is out. So join us on Friday at 12:30, because looking good feels good. Bye. Mwah.